So we are going to be using a NeoBiotech kit, which is the best implant removal kit when you don't know the brand of the implants you need to remove. The kit has 4 different parts. You have the implant remover screw, and you have different sizes. You have the implant removal device, and also you have different widths that have to match with the implant diameter. You have some drivers with short, medium, and long, and then you have a torque wrench. So the first thing we need to do is mount the torque wrench, and this works in a normal way, okay? So we put all the parts together, and then we see that this has 2 arms. One that goes 30 to 80, and it's to torque the screw, and one that goes 100 to 500, that is the big one, to remove the implant. We shouldn't pass the 300 Newton centimeters torque to remove the implant. So the first thing we need to do is choosing the screw that fits our implant. We have different widths here, and it's always good to start with the biggest one. So we select the driver, we can go short, medium, or long, and then we start with the widest one. We connect the driver manually, and then we start checking for engagement. So we see that this one doesn't fit, so we try the next size. This one doesn't fit either, and we try the next one up. This one engages at some position, but it doesn't fully engage. If you see how well the next one engages, you will see what you need to expect. So you see that this one engages perfectly. And now we need to torque it to 30 Newton centimeters. We need to do this clockwise, so we need the arrow pointing to our arm and this arm being in the lower part. So we connect and we go to 30 to 40 Newtons centimeters. So the next bit is selecting the implant removal, and we need to choose the diameter that fits our implant. We have a short and a long version. We will start with the short one here. I think for this diameter, I will go for a 5mm diameter wide engagement. We start engaging it manually, anti-clockwise. Can you see that this fits well on top of the implant? And now once this is stable, we can continue with the torque wrench. On this case, we are going to continue anti-clockwise. We need to move the arrow towards the big arm, and we need the big arm with the 100 to 500 on the top side. So we engage. We make some vertical force to give it stability, and then we start unscrewing. Sometimes it's better if we hold the full torque wrench, but making sure we don't go over the 300. So in this case, we see that it's unscrewing easily, but maybe we could be holding it here as well. And you can see how nicely the implant is coming out. Once the implant is relatively loose, we can continue manually until it's all out. So one last bit that I want to explain is how to dismount all the parts, because obviously this is now torqued at a very high force, and we would like to recover all these bits to be able to use them again. So we will need some kind of pliers or some mosquitoes to hold the implant and engage it, and now use the torque wrench to undo our movements. So we need to change the arrow. Can you see that it has already given? And we'll remove this part first. And now with the driver, And again, changing the arrow to the opposite that we use everything together, and we can dismount all the bits.